Hello, my name is Deborah Schwarzkopf, and I have the website ECT Justice. I have done previous videos around electroshock, and I decided to go ahead and combine them into one video to make it easier for access for my peers and for people seeking information. There's a lot of resources on ECTjustice.com that can provide you with information as well. And for my peers, there's a lot of support groups on Facebook that you can check out as well. I would like to start off by sharing a little bit of the history of electroshock. It was developed in the late 1930s and was used quite a bit in the 1950s and 1960s, and kind of fell by the wayside from public attention for a while. And in the last 5 or 6 years or so, the use of electroshock has greatly increased. It's being used in a lot of your university teaching hospitals. It's being used by the large HMO Kaiser Permanente now, and it is also being used on children and in pregnancy now. Electroshock involves running a high voltage electrical current through the brain, either through one side of the brain, which is called unilateral, or both sides of the brain, which is called bilateral. And this is to induce a grand mal seizure to supposedly help with mental health issues. It's only been approved by the FDA for use in severe depression, but it is now crossed over into the general medical population and is being used in some situations of Parkinson's disease, and it's being used in some cases of autism with children. So it has deviated away from what the FDA has approved use for. When it was first used, they didn't have the anesthetics or the paralytics that are used, so people would frequently break their jaw bones, fracture their teeth, they would fracture their spinal bones, they would fracture the long bones in their legs, which takes extreme trauma to do. So the force of these seizures are intense when generated by electrical means of mechanism. You don't see these injuries in situations of epilepsy. So they later developed the anesthesia and the paralytics to give people so they don't display the outward signs of seizure activity, but still the brain is seizing even though you're not having outward signs of seizure activity. But the brain is still sustaining injury. The devices that are used in the procedure of electroshock, or known as ECT or shock, are made mainly by two main manufacturers, and that is MECTA, based in Tualatin, Oregon, and Somatics, based in Clearwater, Florida. The devices were grandfathered in by the FDA greater than 60 years ago and have never had to have pre-market approval before the FDA, even though they now have design features that have computer automation. They have still not had to have pre-market approval before the FDA. Electroshock itself has never had FDA testing for safety or even effectiveness, and is classed experimentally for both the procedure and the device, and patients are not made aware of that at time of consent. At consent, patients are told for the most part that memory loss is to be around the time of procedure for the most part, and is expected to resolve within 6 weeks. There may be some permanent memory loss, but that is the rarity and not the norm. But actually what happens is that patients are losing extensive memory, and there are lists of damages that are being withheld from patients. This procedure results in traumatic brain injury with each and every single procedure. These are NFL-type head injuries, and this is based on what is known as mechanism of trauma in the field of emergency trauma medicine, and it's appreciated in the literature that electrical mechanism of trauma is known to induce traumatic brain injury, and this is in the literature of emergency trauma medicine, in the literature of neurology, and even in the literature of psychiatry. Electrical injury doesn't cure depression. Electrical injury in the literature actually causes PTSD, anxiety, and depression. It is in psychiatry's own literature. I worked many years as a level 1 trauma nurse, and I worked a few years in the field of addictions with dual diagnosis clients. I had electroshock. I consented to electroshock. I was highly impaired on psychoactive drugs at the time. There was coercion involved. I was told I would not be discharged unless I consented, basically. And so there's coercion, usually some coercion involved. There's withholding of known damages. Patients are in a desperate state, mental state. They often have family members that have been spoken to by the psychiatrists that are also pushing to have electroshock. And so you're caught in a situation where you basically have to do something. And so I consented, and at the time I was being treated by a psychiatrist that was had me on toxic levels of benzodiazepines and hypnotics, to the point that I settled a psychiatric medical malpractice suit around the dosages that I was being prescribed. And the same facility, Kaiser Permanente, was filling these prescriptions and also doing my electroshock and consenting me on toxic levels of benzodiazepines and hypnotics for this procedure. So I was not able to give true informed consent. And I am not alone in this. Many people, many patients are on copious amounts of psychoactive drugs that impact judgment around, and therefore cannot give true informed consent. And you cannot give true informed consent if known damages are being withheld from patients as well. And you cannot give true informed consent if you're unaware that both the procedure and the device are classed as experimental. And you're not able to give true informed consent if most likely your information around electroshock is being entered into research without your consent. So there are a great deal of issues around consent. I lost, after I had electroshock, I lost memories of my college education. I ended up on full disability. I was a classically trained pianist, and I totally forgot how to play piano. I have since taken lessons since stopping electroshock, and I cannot advance it past an early intermediate level. I have no ability to memorize music. I have 2 grown sons, and I don't remember much of their lives, not one holiday, not one birthday that I shared with my children. I don't remember the graduation of my children from high school. And this is happening in many other patients. We are sustaining up to 3 NFL-type head injuries a week into the double and sometimes triple digits. We often turn to our psychiatrist and explain that we're having significant neurocognitive damages, but we are not validated. It is attributed to psychiatric cause, and we are in fact offered more electroshock because our damages that we're complaining about are attributed to psychiatric cause or a mental health challenge, and therefore we might benefit from additional maintenance electroshock on top of what we're already dealing with. These damages that I've spoken about, physicians are well aware in other fields of medicine in what is taking place around this procedure. They just don't speak up about it to protect patients. They protect fellow physicians, they protect fellow facilities, and we are a marginalized population that is not seen as being credible or reliable, and so our complaints are easily brushed under the carpet to continue with this practice. But my feeling is that this is a form of battery around patients, and that patients are being highly injured by this procedure. Many lose their careers, they lose their talents. If you're creative, you often lose your ability to create. Mothers lose the maternal bond with their children. This is used in postpartum depression. So mothers that I've heard of lose memory of the birth of their children. I know I did. They lose that connection that follows the bonding with their children. And it's very difficult to establish that again. And not only do we lose our past memory, but we are greatly compromised in the ability to form new memory. I have interactions with people daily, as everybody else does, and I cannot hold on to conversations that I've had. I'm not talking just details. I'm talking the general gist of the conversation, or the fact that I even had a conversation with them. We can't remember even what occurred 2 days ago for myself personally. I know in my journals that it reflects that I was able to hold on to memory a little bit lasting a week about a year ago, but now it's down to a couple of days. And I can't recall what's happened even a couple of days ago. And I'm not alone in this. This is happening a great deal in patients. I would encourage friends and family members to go on Google and research traumatic brain injury. Research low voltage electrical injuries, that's less than 1,000 volts, and you will see these damages reflected. Psychiatry states, and it does show that patients on the unit do improve following electroshock, but how they improve is secondary to a traumatic brain injury, in that when you have a traumatic brain injury, it is not uncommon to experience euphoria. And psychiatry misrepresents this as improvement. But what it is, it's a response to an assault on the brain that's happened, secondary to an electrical mechanism of trauma inducing a traumatic brain injury. And oftentimes patients will lose memory for the difficulties that led to admission. And that is also seen as improvement by psychiatry. But once again, that is a mechanism of electrical trauma inducing a traumatic brain injury, and patients have memory loss. When you have this procedure and the acute symptoms of the euphoria wear off in about 6 weeks, then you're going to have your worsening psychiatric symptoms coupled with permanent and extensive neurocognitive damages to deal with. And you're not going to have anybody, for the most part, to validate you. I know as a trauma nurse, I went to see a neurologist, and the neurologist was associated with the facility that did my electroshock. And they do not want to attribute your neurocognitive damages secondary to electroshock because then it opens up their facility for lawsuit potentially. So then again, they attribute it to psychiatric cause, whether it's your depression or your psychiatric drugs, and they neatly sweep it under the carpet, and you're left feeling crazy because you're having all these neurocognitive issues and nobody to validate you. Many times following this procedure, because we suffer from significant PTSD following this, and anxiety and depression following electrical injury, we have a great fear of seeking out medical care. So our medical care, we become negligent around it because of our fear. And we often have a great deal of fear seeking out psychiatric assistance. And when we do find psychiatric assistance, I have heard on my website, ECT Justice, from peers, they're often not validated by therapists who, again, seek to protect their fellow providers. There are the rare instances I've heard of that therapists actually do validate and support their clients around this procedure, but for the most part, they protect their facilities and their fellow providers. There is, this is big money and big cover-ups. Physicians make 2 and 3 times the money that typical psychiatrists do that don't do this procedure, and they're doing it 3 times a week for a great number of procedures, so there is a lot of money involved here. I have heard of, from my peers, of some family members that break off contact with patients in their family members. They break off contact with their family members if they don't want to have more electroshock. I've heard of psychiatrists that abandon patients in crisis because they won't consent to further electroshock. So psychiatrists do make a great deal of money around this. And so if you're a family member and your loved one is having this procedure and you've researched this and you believe this is what is taking place, then I would intercede on your family member's behalf because they're greatly compromised during this procedure and don't have the insight or the judgment, for the most part, to put a stop to that or put a stop to it. And most of your consent is signed in a series format, which means they sign consent for shock between like 1 in 6 or 1 in 12 procedures. And that takes away the risk of the patient not signing further consent. So family will have to intercede. So I have heard on ECT Justice from some peers that they have found electroshock beneficial. My response to that is patients also suffer from what is called anosognosia following traumatic brain injury, and that is the failure to recognize the extent and the severity of known damages or incurred damages. And that's why patients have a great deal of difficulty seeking out legal representation within a time frame, because they're greatly compromised around recognizing that they've in fact suffered damages. So this may open up time frames if medical malpractice attorneys perhaps look at this angle to extend time limits for patients. I feel down the road there may be potential for medical malpractice suits. They are negligent in consenting around, giving informed consent for patients. Patients are highly impaired on psychoactive drugs at time of consent. That impacts judgment. The experimental status of both the device and the procedure are withheld from patients. The patient's information is most likely being entered into research without patient consent. There is also the risk of, there's also the issue of material risk, and at the top of that list is brain damage that's being held from patients. So there is arguments for medical malpractice, I feel, down the road. Currently, there was a class action product liability suit filed by the DK law firm in California on September 11th of 2017. This currently impacts California residents. This is expected to become a national suit. There's a survey on ECT Justice I'm asking people to fill out to share your information. Please fill out the information on that survey. There is also a media page set up on ECT Justice that I hope peers and friends and family members will fill out to speak out about electroshock. I feel that if we can get enough public attention, public light shed on this, that physicians should be very afraid to continue with this practice for fear of lawsuits similar to the NFL head injuries that are taking place. I hope that you will share these videos with other psychiatric support groups and Parkinson groups and autism groups, that you will step in and intercede for your loved ones that are having this procedure. I would encourage, if you have the monetary means or the insurance, to, if this is my peers or friends and family of loved ones that have had electroshock, to seek out assistance at a teaching hospital, a university hospital. They have a lot of resources there in their traumatic brain injury program. Do be aware that these facilities do practice electroshock, and when you go to see the neurologist, that most likely he will say that he's seen this be useful for patients through one of his rotations in psychiatry. At this point, you can inform the neurologist that this is a frank mechanism of trauma, that if this occurred in a home setting, electrical mechanism of trauma happened in a home setting, and this patient was seen in the emergency room, that this would be seen as a traumatic brain injury. I would insist on extensive neurocognitive rehab, and I would insist of that neurologist to have neurocognitive testing by a qualified certified psychologist that deals in traumatic brain injury. I would insist on having an EEG. There is the standard EEG, There's an evoked potentials EEG or an EPEEG. There's a QEEG or a quantitative EEG. You can have an MRI with contrast and without contrast if you can tolerate contrast. And you can ask for a functional MRI. I would also ask for any of the newest testing out there around concussions or NFL head injuries and get those done as well to identify injuries. I would also encourage my peers to go on the medical records section of ECT Justice and pull all of your electroshock consents, all of your ECT consents. If you've had prior testing of any of those tests that I've already mentioned, then I would pull those results as well. Follow the directions there. You don't need to pull everything that's listed, just what I've just mentioned, especially consent. You'll probably have some difficulty in obtaining some of these records. If you scroll down to the end of the medical records section, there is information about starting a log to report them to the Office of Civil Rights if they fail to turn over your medical records, and you may have to proceed with that. When you have any testing done, the MRI, the EEG, I would also perhaps get a CAT scan done. No, that's one of the older tests. I would encourage you to get a sleep study done, even if you've had one previous. And I would encourage you to have an ophthalmological exam done, as cataracts are sometimes seen in electrical trauma. And when you have the MRI and the EEG and the sleep study done, ask to have the exam itself put on a CD at the time of the exam. Don't get it from medical records later. Take it with you from the exam. And that way you can get an independent reading at a later date if it becomes necessary. This is not the radiology report. This is the exam itself. I would encourage you to do that. I think that is it. If your friends and family members, please support the individual that has had electroshock and stand up for them and insist on getting appropriate testing around this. There are books and resources on ECT Justice that you can have as referrals. And I appreciate your time, and thank you very much.